Another day, another story. In recent times, the field of cardiology has witnessed a transformative shift in its approach to heart failure prevention and management. The American Heart Association, AHA, in collaboration with the American College of Cardiology and the Heart Failure Society of America, has unveiled updated guidelines that promise to reshape the landscape of cardiovascular care. These guidelines represent more than just a set of recommendations. They are a beacon of hope for the millions of individuals affected by heart failure. Heart failure, a chronic and life-altering condition, casts its shadow over the lives of over 6 million adults in the United States alone, according to the most recent statistics provided by the AHA. Its multifaceted etiology encompasses risk factors ranging from narrowed arteries, prior heart attacks, and hypertension to heart valve abnormalities, metabolic disorders, autoimmune ailments, and even exposure to certain medications like chemotherapy. The latest guidelines, fresh off the press, signify a paradigm shift in the approach to heart failure, one characterized by early intervention and comprehensive risk evaluation. The revamped guidelines introduce a novel concept, Stage A, which sets its sights on individuals at risk for heart failure yet to manifest structural heart disease or myocardial injury. This particular stage casts a wide net, encompassing a substantial proportion of the American population. It comprises individuals grappling with high blood pressure, diabetes, obesity, those who have faced the rigors of chemotherapy, and individuals with a genetic predisposition to heart failure. The clarion call is for individuals to embark on a relentless journey towards a healthier lifestyle. Physical activity becomes a cornerstone, underscored by the merits of a balanced diet and the imperative of abstaining from smoking. Maintaining a resting blood pressure below the 120/80th threshold is strongly advised. Furthermore, for individuals contending with type 2 diabetes or cardiovascular conditions, the consideration of SGLT2 inhibitors to manage blood glucose levels becomes a valuable tool in the armamentarium against heart failure. Stage B encompasses individuals who have not yet displayed overt heart failure symptoms but bear the hallmarks of structural heart disease. These signs may encompass indicators of myocardial injury, inefficient myocardial pumping, myocardial hypertrophy, abnormalities in myocardial contractility, or valvular anomalies. Medicinal interventions may be deemed necessary for individuals occupying this crucial stage. In Stage C, the stage of symptomatic heart failure and established structural heart disease, individuals grapple with a spectrum of debilitating symptoms: shortness of breath, persistent cough, edema in the extremities or abdomen, debilitating fatigue, and distressing nausea. At this juncture, the guidelines advocate for a multidisciplinary approach to care and continuous monitoring. Furthermore, vaccination against respiratory ailments, including the ever-pervasive COVID-19, stands as a critical recommendation. The guidelines also refine the categorization of left ventricular ejection fraction, LVEF, a pivotal metric for informing treatment decisions. Stage D is a realm occupied by individuals who contend with advanced heart failure, grappling with symptoms that profoundly affect their daily lives and often culminate in recurrent hospitalizations. For individuals traversing this terrain, the guidelines prescribe the judicious use of implantable cardiac devices and comprehensive management of coexisting heart conditions. The research spotlight has recently illuminated the potential of dapagliflozin, an SGLT2 inhibitor, in the context of acute heart failure management. A meticulously controlled study, involving 238 patients, unveiled promising outcomes when initiating dapagliflozin therapy before hospital discharge. The drug exhibited prowess in augmenting diuresis and natriuresis, culminating in a reduction in diuretic dosages and an expeditious commencement of guideline-directed therapy. This study underscores the pivotal role of early intervention with SGLT2 inhibitors, shedding light on their capacity to optimize the therapeutic regimens of heart failure patients. Semaglutide, initially conceived as a diabetes management drug and now harnessed for weight loss, has taken the cardiology realm by storm. Recent clinical trials have unfurled the startling revelation that semaglutide can orchestrate substantial improvements in heart failure symptoms and the overall quality of life for obese patients. The drug operates by mirroring the actions of the GLP-1 hormone, stimulating insulin production and signaling satiety to the brain. While the American Heart Association treads cautiously, the potential for semaglutide to emerge as an additional therapeutic option for heart failure with preserved ejection fraction, HFpEF, is nothing short of intriguing. The drug's repertoire includes marked enhancements in heart failure symptoms, weight reduction, diminished dyspnea, reduced edema, and heightened physical activity levels. Obesity looms as a grave concern, ensnaring nearly 42% of the American population in its clutches. Recent epidemiological studies have unfurled a disquieting narrative: a surge in obesity-related cardiovascular mortalities. The numbers speak volumes, with obesity-related heart disease deaths soaring from a modest 2.2 per 100,000 individuals in 1999 to a staggering 6.6 per 100,000 in 2020. The brunt of this burden is disproportionately borne by Black individuals, followed by American Indian and Alaska Native adults. This disconcerting trajectory accentuates the exigency of tailored public health initiatives specifically targeting obesity and its intricate web of cardiovascular ramifications. A recent study, slated for presentation at the American Heart Association's Hypertension Scientific Sessions 2023, has unearthed a compelling correlation between supine, lying flat on one's back, blood pressure and the risk of heart-related maladies. This revelation signifies a pivotal departure from the convention of measuring blood pressure solely in the seated position. The study scrutinized data sourced from 11,369 adults and gleaned that solely assessing blood pressure while seated may inadvertently sidestep the cardiovascular disease risk intrinsically associated with supine blood pressure. Participants who demonstrated elevated blood pressure in both seated and supine positions confronted markedly heightened risks of cardiac-related conditions and premature mortality. The study propounds that individuals vulnerable to heart disease and strokes ought to undergo blood pressure assessments while lying supine. Future research endeavors are poised to delve deeper into the merits of monitoring supine blood pressure during slumber. Notably, the study primarily centered on middle-aged adults, and the full ramifications of its findings for the elderly population remain an avenue ripe for exploration. A recent study emanating from Kyungpook National University Hospital, South Korea, reveals a profound revelation. Individuals who abstained from adding salt to their meals experienced an 18% reduction in the risk of being diagnosed with atrial fibrillation, a condition marked by irregular heart rhythms or arrhythmia, compared to their salt-loving counterparts. The implications of untreated atrial fibrillation are nothing short of dire, encompassing potentially life-threatening scenarios such as stroke, heart failure, and the formation of blood clots. For individuals who have previously weathered a heart attack, a daily regimen of aspirin may well be the harbinger of a more sanguine prognosis. This revelation, stemming from a recent Danish study, underscores the capacity of daily aspirin intake to curb the risk of recurrent cardiac events or strokes. Presented at the ESC Congress 2023 in Amsterdam, the findings reinforce the current clinical guidelines about aspirin therapy following myocardial infarction, heart attack. An intriguing sub-analysis, rooted in Fitbit data drawn from the chief HF, canagliflozin, impact on health status, quality of life and functional status in heart failure, trial, unveils a compelling insight. Patients grappling with heart failure who augmented their daily step count by a modest 1,000 strides bore witness to clinically significant improvements in disease-related outcomes. In conclusion, the latest guidelines emanating from the American Heart Association, American College of Cardiology, and Heart Failure Society of America have ushered in a new era in the realm of heart failure prevention and management. These guidelines, steeped in comprehensive risk assessment and early intervention strategies, hold the potential to redefine the prognosis and quality of life for millions grappling with heart failure. As we embark on this transformative journey, one thing remains abundantly clear: the pursuit of cardiovascular well-being knows no bounds, and these guidelines are but the opening chapter in a story of hope and resilience.